mold remediation evidence review, but there are a number of other documents that were produced for the NCCEH. I'll be discussing those in brief, but really the majority of the talk today will be about remediation. I will be giving a brief introduction to microbial hazards in indoor environments, and I think a lot of you in this room are already quite familiar with microbes in indoor environments, so that'll be fairly brief. I'll go over this evidence review that was done for the NCCEH on mold and health effects in indoor environments. As well, I'll talk briefly about a toolkit that was produced for environmental health practitioners and policymakers with the intent of really trying to show them how an investigation takes place, how to read a laboratory report, how to read a consultant report, those sorts of things. And then the bulk of the talk will be about mold remediation and this evidence review that was done that was recently updated. It's going to involve looking at the summary of guidelines and then the evidence behind those guidelines. And what you'll see throughout this presentation is that some of that evidence is inconsistent, and there's really not very much evidence behind some of those guidelines, but we'll discuss what's available. So just a quick intro to microbes in the indoor environment. They're everywhere. We know that. And we're exposed daily, which makes this a little different from other kind of contaminants that we might deal with in the workplace. And it makes interpretation a little bit more difficult too, because for certain chemicals, for instance, we're probably only exposed to that in a certain area with a particular source. But here, we're exposed everywhere, and there are sources everywhere. And sometimes these microbes can be a concern, a health concern in indoor environments, and I'll talk about that in briefly in a minute. So fungi, they're eukaryotic, meaning they have a nucleus. They degrade organic matter, so we rely on them much of the time to sort of degrade in our cycle of life. We really need these organisms. And you might hear these terms: yeasts, molds, mildews, rusts, smuts, and mushrooms. They're all under fungi. And so, as you can see, they're both macroscopic and they're microscopic varieties of fungi. And most produce spores. So what these are kind of like, they're kind of like little seeds. They're little round spores that are their reproductive structures. And yeasts tend to bud. They don't tend to sporulate. These spores can be dormant for long periods of time. They can survive for years and years and just stay there. And then when the conditions are right, then they will grow again. So that makes it difficult sometimes when we're dealing with remediation. Bacteria, they're single-celled prokaryotic, meaning they have no nucleus. They're also found everywhere, quite ubiquitous. Some are parasitic. Some also produce endospores. And they're a little different from fungal spores in that they're not reproductive structures, but they allow the bacteria to remain dormant for periods of time. So anthrax, for instance, we're familiar with the white powder of anthrax and the issues that occurred maybe 10, 15 years ago. So those were endospores. So what's required for microbial growth? Well, you need some kind of food. And by food, that's anything organic. So I've seen it grow. You've seen it grow on drywall, on wood, on carpet backing. I've seen it even grow on insulation, even though the insulation itself may have been fiberglass and not organic. There's dust and debris that settle on insulation, so it can actually grow inside that insulation. And there's a case where I've seen it grow inside mattresses, for instance. There was a manufacturer of mattresses that allowed those mattresses to be unzipped. And so they had a warranty on these mattresses for their customers. And they said, if you have an issue with them, just bring them back and we'll replace them. So people started unzipping their mattresses and finding mold in the mattresses. And so one of the projects I was involved with was trying to look at why the mold was growing, because they had all these antimicrobial products. The materials were antimicrobial in the mattress itself. But what was happening was there was layers of padding and then like a bladder, which was like a water vapor barrier, essentially. So what was happening was people were sweating or urinating or whatever they were doing in their beds. and then there's also organic matter coming off them, shedding of skin and dander from animals and things like that. So that was providing a nice place for mold growth. And in fact, we showed that the materials themselves weren't conducive to mold growth. It was actually just the settling of other things on there. So I've seen it grow in various areas. And it really needs just the right temperature is quite variable, between 5 and 38 degrees Celsius. So room temperature is just ideal for most of the fungi that we're talking about. and bacteria we're talking about. And then it needs water. So the only thing that we can control in indoor environments is water, because everything else, there's a food source, there's the right temperature. So we try to deal with the water source. So what are the components of concern? So for molds, we have mycotoxins. And you might be familiar with one mycotoxin, which is penicillin. And it's produced by Penicillium chrysogenum. This is a mycotoxin that's a competitive inhibitor for that fungi. It's also very useful for humans because we use it also to kill off gram-positive bacteria. But they're also toxic, right? So there's also spores, these reproductive structures of fungi that can be an issue, and they can also have mycotoxins adhered to the surface as well. There's structural components of fungi, and what I mean by that are not the spores, but the sort of the hyphal fragments, the branches, the branch filaments that you see here. Those can be breathed in and can also be of issue. Volatile organic compounds can be irritating as well, and these are caused by metabolites of they're metabolites of microorganisms. And this is the smell that you smell, that musty odor, that smelly dog smell that you often equate with mold growth. And for bacteria, endotoxins can be an issue. That's in the sort of cell wall of gram-negative bacteria. These can cause a great immune response in animals and humans. So how can you be exposed? Well, the normal pathways, the ingestion, dermal contact, and inhalation. Now, we know from ingestion there have been incidences of poisonings and such by eating moldy foods. This is very common in some areas still, where they'll have grain outside or they'll have rice outside, and then there'll be snow cover, or they'll leave it over the winter. It'll get moldy, and then they'll eat it in the spring. And so there have been incidences where there's been some issues with this ingestion, both for animals and for humans. And for instance, moldy peanuts, a lot of times it has an Aspergillus species on them producing aflatoxin. And aflatoxin is a hepatocarcinogen. So we do know ingestion can be an issue, but that's not something we're really talking about in indoor air. Neither are we talking about dermal contact. Dermal contact may be important for people who are working in composting, for instance, or areas where they're actually dealing a lot with handling of moldy materials. So really what we're dealing with is inhalation, and that's the topic that we're going to be covering today. And remediation is all about trying to reduce this type of exposure. So what types of health effects can occur? Well, there can be systemic fungal infections. So we know that people who are immunocompromised can become susceptible to certain diseases like aspergillosis, which is caused by some Aspergillus species. And aspergillosis, what that is like there's a fungal ball that forms in the lungs, and it causes difficulty breathing. It can cause liver and kidney problems and eventually death. So we know that there are those sort of fungal infections. We know that there's sort of allergic type reactions that occur as well, those also irritant, non-allergic type reactions. And I'll talk a little bit about what toxic effects are seen as well. So the potential for adverse effects really depends on the exposure concentration and the length of exposure, potentially a specific species to which the person is exposed, the route, and then individual susceptibility. And really right now there's no safe or unsafe level that we know about. It hasn't really been determined. There's no dose-response curve that we know about. And also there's limited diagnostic tests at this point. So we can test if you're allergic to fungi, but that doesn't tell us when you're exposed or how much you're exposed to. There's no accurate tests to look at your mycotoxin exposure, for instance. I just want to talk briefly about the health effects from mold exposure. This is the evidence review that's actually available on the NCCEH website if anyone's interested. But essentially, just to give you a brief overview, what we're finding is that there's no sort of causal relationship between mold in indoor environments and health effects, other than sort of systemic infections and those sort of non-systemic infections that we know about, like fungal, nail, and things like that. But there is sufficient evidence for an association with asthma, both in the exacerbation and even development of it. Upper respiratory symptoms, cough, wheeze, hypersensitivity, pneumonitis, respiratory infections, eczema. But there's limited or suggestive evidence for association with a common cold or allergy or atopy. And there's inadequate or insufficient evidence for an association between like airway flow obstruction or mucous membrane irritation syndrome, GI problems, skin problems, fatigue, non-occupational inhalation fevers, cancer, rheumatologic and other immune diseases, reproductive effects, and also this last one, the acute idiopathic pulmonary hemorrhage in infants. Now this one's a very interesting one because back in the mid-90s or so, there were these clusters of babies actually in Cleveland and Chicago that were experiencing this condition, which meant they were bleeding in the lungs. So it was really quite alarming, you can imagine. I don't know if many of you are old enough to remember, but this hit the media pretty hard, actually. And based on the investigation that was done, the Centers for Disease Control went in, and they determined that there was an association between a particular type of fungi, Stachybotrys atra at the time, now it's called Chartarum, and this type of syndrome, this type of hemorrhaging. And so what happened there was the media hit on that quite hard, and they started calling this the black toxic mold. So you've probably heard of that term, and it's been coined and used quite a bit. Now there's a lot of different black molds, and many of them produce mycotoxins, but this one became particularly sort of notorious. And after the fact, CDC came out with an amendment and said, actually, some of the studies were, some of the work was not as certain as they thought because the study wasn't blinded properly, and we think there's an association, but there might be other things at play. And one of the things at play was that they found that in these homes there was also smoking, so there might be a synergistic effect that was happening that was causing this. Anyways, the media didn't glom onto that at all. so what happened was they really ran with the black toxic mold phrase, and it was all over the media, all over the news. And that's when a lot of professionals in industrial hygiene and other industries started getting into mold work. And so probably the mid-90s to the late 1990s, people just came out of the woodwork. You know, excuse the pun, but we really did. And that's when I started working in the area of mold too, because it was just something that was on everyone's minds. Everyone was really concerned, and there were a lot of litigation cases at the time. I worked in the U.S. at the time, so it was quite litigious. So I did want to stress that for a microbial inspection, that really the most important part of the investigation is a physical examination of the area of concern. That can include evaluation of the relative humidity levels, moisture content of building materials and contents, and presence of standing water. And really, this is more important than sampling. And I know a lot of times as hygienists, we want to get right in there and start to do some sampling. But essentially, a lot of times you don't need to do the sampling. You know what the source is, you know what the problem is, you can fix the problem, and that's it. So I wanted to stress that because I think that's very important. So for instance, I just wanted to show you some examples of like a visual inspection. So you might look here and there's some sealant issues that you could notice that may be causing problems. Here there's improper grading. So you can see they tried to do something about this improper grading with this little barrier here. Now you'll see how effective that was. So that's the interior of that same spot. And what you're not seeing here is there's mushrooms growing on the carpeting, et cetera. So it's really it's really quite wet in this environment. Really, you don't need to take any samples. You know what's happening. You know what's causing the issue. You can fix the underlying source. And here, this is an example of a high occupancy situation where this was a home in California where there were about 13 people living in a 1,000 square foot home. And so what was happening was they had furniture up against the wall. And actually, this is very similar to the home that I owned in California. It was a ranch home just like this. We had single paned windows. You can see here condensation on the windows themselves. You don't see single pane windows here much, but they're very common, and there's no insulation in the walls and such in the attics and whatnot either. But anyways, so what had happened here was there was furniture up against the wall, and then when you remove the furniture, you were able to see all this mold here. And I've experienced that myself with, it actually happened in Edmonton where I lived for a while, And I had been using a humidifier every night because I was from Vancouver and I was not used to the dry, the dry weather out there. So I was using it every night. And then by the time I was about to move, I moved away the furniture, and then I saw all this mold on my wall as well. So this was before I started getting into mold work, but it happens quite commonly. Here's a situation of high humidity. I've been in homes where, this is the underside of a dresser drawer. I've been in homes where they've had aquariums and terrariums and things like that, where it's very moist. You can go in there and my glasses would fog up immediately. So I didn't even need a moisture relative humidity monitor to tell. But there are environments where there's just really high humidity, and this can result. Building construction can be an issue too. So here in California, there were a lot of flat roofs. So this is all standing water right here. And where does it go? If there's any kind of penetration, go straight through there. And here, a lot of air handling units were on rooftops, less so here. But if any penetration was present, of course, you get water leakage. Here, you probably don't get this so much, but in certain areas in Canada, this could be an issue with the ice dams. So what happens here in some areas is that you can get snow melting because of warm air rising in the roof. Snow melts, it comes down as water. Then as it gets to the edges, it starts to freeze because it's colder at the edges. And so then it forms a sort of dam. And then what ends up happening is you can have the siding start to ripple a little bit, or if there are any penetrations in that roof, the water comes right in. So this is an issue in a few cases that I've seen around in northern BC and up in the territories where there's a lot of freeze-thaw that happens. So I wanted to just briefly talk about this microbial investigation toolkit that we produce for public health inspectors and environmental health officers across Canada, because they really wanted to understand, how do you conduct a walkthrough inspection? Some of these folks are responsible for actually doing some investigation. Some people are just answering questions from the public. So they had a variety of needs. So we tried to put together a toolkit for them that would allow them to understand what goes into a walkthrough inspection. How do you evaluate indoor environments for microbes? How do you do the sampling? What kind of sampling is there? Those sorts of things. And also how to understand lab and consultant reports. And so these are just some examples of checklists and forms that we put together that can assist. And they might be useful to you as well if you ever find yourself having to do a microbial inspection. We talk about types of microbial sampling. We also talk about types of fungi that are indoors and what they might mean. So some fungi are a bit more hydrophilic, they're more water-loving than other fungi. And Stachybotrys chartarum is one of them. It's really highly water-loving. So if you're seeing that in any great quantity inside, you know that there's a source likely, because you don't normally see that in outdoor air. And also that there's probably been a long-standing water intrusion issue and it's quite wet, quite damp. So anyways, we'll move on to mold remediation. So what do you do if you have a mold problem? Well, you remove the source of water, and that may sound very common sense, but there's so many times, I'm going to mention this again and again, and I'll give you examples of when that wasn't done. There's so many times when that's not done, and there's remediation that occurs, and the water source is not being dealt with, and then of course it happens again. And then, of course, removing and replacing any porous or semi-porous materials, and then cleaning hard surfaces. There's multiple guidelines that talk about these. I'll discuss them in a bit in a moment. So we want to reduce risk through proper planning at the first stages. We want to be able to have a strategy for addressing that remediation. We want to have a systematic approach. And we also want a way to safely remove those microbial or moisture damaged materials from that space. So you don't want to be traipsing around moldy materials through a clean space. It's much like asbestos or lead paint abatement. You want to be able to contain it and make sure it gets out of the building safely. Larger remediation plans are often necessary for larger jobs. They might be very specific as to like a step-by-step procedure, very much similar to the hazardous materials type abatement plans that we have. And much of the mold industry has actually followed in the footsteps of asbestos, the asbestos industry. And also may involve removal of vulnerable populations. And I talked about this before with the babies and this potential association with this pulmonary hemorrhaging. But also there's nosocomial infections that happen with immunocompromised people in healthcare facilities, etc. So this is very important sometimes to remove those individuals if you're going to be doing some type of remediation. I was involved in one case where there was a hospital where we had to remediate the outside, the exterior cladding of the hospital. But rather than removing all the patients, what we did was really isolate that containment. And we actually shrunk wrapped the entire exterior cladding of this hospital. And what was of issue here was this, there was this EFIS siding that was, I don't think it's used much here in Canada, but in certain climates it is. And there were issues with it. It looks like styrofoam with a elastomeric sort of coating on top. And so you can imagine sometimes if it's not installed properly, or if there's any kind of penetration or anything like that in it, there might be some issues. So that was the case in this hospital environment. So rather than removing those vulnerable populations, we actually really isolated the area that we were doing remediation. So I wanted to stress that if there are hazardous materials present, such as asbestos or lead paint, that really the hazardous materials survey needs to be done before remediation. And hazardous materials like asbestos and lead paint, they trump sort of the mold abatement procedures. So usually the procedures that are necessary for asbestos or lead paint will be sufficient for mold remediation. So we also want to reduce risk through personal protective equipment. So we want, all the guidelines really recommend using gloves. Most recommend some kind of respirator, like a half-face N95 respirator at least, some kind of eye protection. Large jobs may actually require more PPE, like this one. You can see this fellow here. This is a large job, right? So he's wearing a full face mask with P100 HEPA cartridges, disposable containment suit, and full foot and head covering. We also want to reduce risk, of course, through containment itself. So containment is guided by things like the amount of microbial damage or water damage, location, distribution of that microbial contamination, extent of the building or material deterioration, the type of building and occupancy, and we talked about that already with the hospital example. Also the remediation strategy, what you really want to be removing and doing in there, and then any other hazards present, like the hazardous materials. So the strategies do include limiting access, preventing dispersal of any dust, any of the molds that you're removing, isolating them, and then for larger projects, negatively pressurizing the containment so that you're not getting that air that's coming out into the cleaner areas. So there's different types of remediation decisions that are made. Most are size-based, size of the microbial growth that's seen or the mold growth that's seen. And one of the first ones that came out was this New York City Department of Health guideline back in the late 1990s. And this was actually looking at Stachybotrys atra at the time, now called Chartarum, because of this concern with Stachy that was really evident in the mid-90s. And so they came up with these size guidelines. And when I looked at the evidence behind them, I was trying to figure out, where do they really get, this less than 10 square feet you can clean on your own sort of thing. When I talked to people, I heard, and I don't know if this is an old wives' tale or what, but anyways, I heard that the person who was writing this guideline was at his kitchen table one night and said to his wife, "How much mold would you feel comfortable cleaning?" And she sort of put out her hands, like this wide and this high sort of thing, which is the extent of how long her arms were. And that's about 10 square feet. And so that's where the evidence lies, or at least that's what I've been told. And I haven't been able to find anything to contradict that. And so from that, then there's all these other size-based guidelines that have come out that really sort of mirror the New York guidelines. So the EPA, US EPA guidelines, the Canadian guidelines, they all sort of refer to similar quantities of mold and similar types of containment and PPE. One different organization, the Institute of Inspection, Cleaning, and Restoration Certification, does things a little bit different. They actually don't base it on size, they base it on condition, and I'll talk about that in a minute. So this is a table summarizing the size-based guidelines. They're all fairly similar. There might be some differences, but essentially this is a pretty good summary that's in the NCCEH document if you're interested in finding that. So really, they say small areas, less than 1 square meter, you can clean up yourself. Occupants can clean up themselves, and with minimal sort of PPE. And there's disagreement about whether any containment is necessary, but a lot of people recommend at least having some kind of drop cloth if you're doing anything that's small. And then moderate 1 to 4 meters squared of visible mold. There's a little bit more that's required, but they recommend that occupants can clean that area up too with some PPE and minimal containment. Larger areas, they say professional remediation only, full PPE and air filtration, etc. So this is a tool that we included in the toolkit for mold remediation. It's similar to that table. It's just a visual. It helps sort of guide people through the mold remediation process through a visual means instead. So what it has are rings on it. And so the first ring identifies the affected material. If it's been only 24 to 48 hours, there's sort of simpler cleanup methods that are required, because there's evidence that shows that between 48 and 72 hours, or past 48 to 72 hours, you can get mold growth. So then there's a next step where it's a little bit more involved to do that cleanup. So for step 3, you're looking at greater than 48 hours have passed. So there's a ring that determines the contaminated area, the next ring that says what kind of cleanup actions are needed, the 6th ring specifies PPE, and the 7th ring specifies level of containment required. And just to give you an example, if you had a small water leak on an exterior building, unknown time frame when it happened, and the drywall's impacted, but and there's evidence of some possible microbial growth, you go into the rings and you go, okay, well, there's less than 10 square feet of microbial growth there. Therefore, we can clean up with method C, which means drying and then HEPA vacuuming the surfaces. And then the type of PPE would be gloves and N95 respirator goggles. And then ring 7 says there's no containment necessary. So it's just another tool, very similar to the table. It just depends on what you'd rather use. So for the summary of condition-based guidelines, the IICRC uses this. And for condition 1, they say that's just your normal fungal ecology, what you would find in this room today, in the carpet, on tables and things like that, in the upholstery. Just your normal, what you normally find. Then there's the condition 2, which is your settled spores, which if you've had an incident or some kind of event somewhere else and there's been settled spores and some contamination from that, then there's that kind of condition. And then condition 3 is actual growth. So it's very interesting in that they don't differentiate between a little growth and a lot of growth, but it's sort of up to professional judgment in this case. So AIHA does things a little bit differently. They look at multiple factors, including size base, but they look at dampness and moisture damage as well. They also look at the location of the mold relative to the occupant. They classify the moisture damage into low, medium, and high. So you also want to reduce risk through quality assurance and quality control. So you want to do this before, during, and after remediation activities. I mentioned this before, but I'll mention it again. You want to ensure that that moisture source is eliminated. And there's been a few events where, I'll give you an example where I worked in a dormitory, a residence building, where I was brought in probably the 3rd or 4th year that they had this water intrusion problem. Every time there were heavy rains, and so they couldn't figure it out. It was a pretty large building. It was a pretty new building, and what was happening was in really large rainfall, they would get water coming in through the stairwell and coming down into the dormitories, and the wall that was between the dormitories and the stairwell was getting wet, and there was mold growing on the dormitory side and on the stairwell side, and mostly on the bottom few floors, because of course water gravitates towards the bottom, right? So we were seeing that, and I was brought in probably 3 or 4 years after the fact. They'd already remediated all these this stairwell wall 3 times. So they had completely removed it and gotten rid of the mold, and then it happened again the next year, next winter. And so they were going, we're really getting tired of this, right? We really want to figure out what's going on. And so when we did an inspection, this time we had building envelope engineers and building science folks as well. But when we did the inspection, yes, we found the mold and the moisture that was mainly in the bottom floors. And when we went on the roof, we saw that they had tarred up the roof completely, like with putty and roofing repair compounds. And it was just, you couldn't see anything. They had really thought it was the roof, and they tried to do something with the roof. But this time what happened was we did some spray testing. So we spray tested on the roof and then spray tested on the side of the building. And what we found was, again, it was this EFIS material that was cladding the outside. And what had happened was during construction, they had put in some screws and things like that and then decided, oh, that was the wrong spot, and they moved those screws elsewhere. But they didn't fill in the areas where they had put those penetrations. And so we were only seeing this moisture intruding into the building when there were heavy rains, when rains were hitting the side of the building quite hard. So we weren't seeing it when it was just raining lightly, you know, and in California it doesn't rain usually that hard, but occasionally we'd have some heavy rainstorms where that was happening, and then you get all this water that was coming down into that environment. So yeah, ensuring that moisture source is eliminated is very important. Choosing the appropriate PPE and containment, ensuring that dust suppression is being practiced as well, and then removing of those materials appropriately. So again, eliminating the moisture sources. So this is an example here of spray testing. So, you know, we'll have here, usually for homes, you can just connect this structure to a hose bib, and it'll just spray for long periods of time. And you can imagine when you're inside, usually you're looking at a wall that's already been open, and you're waiting for water to come in. So it's a bit like watching paint dry. So you're waiting for water to come in. So you have like a little, what looks like little litmus paper strips. It's really just almost like paper towels, but they're colored. And you put them in different areas that you suspect may be leaking, and you wait. And usually you wait 15 minutes, 20 minutes, maybe half an hour. And for one window, that's okay. But if you're waiting for, like, you know, all the windows in this home or whatever, then it can be quite an onerous and long process. And you can imagine that a lot of times these cases were litigation cases. So we'd have 17 professionals waiting, all staring, all staring, you know, waiting for the water to leak, and then kind of going, oh, phew, it's not my client's issue, you know, afterwards. So, but it was very funny. It was nothing more amusing than seeing all these people just kind of waiting and hoping, you know. But anyways, that's a good way of actually trying to identify the moisture when it's really not obvious, or if it's coming from somewhere else and it's sort of making its way through, just like in this dormitory example. So the mold was happening way at the bottom, but that's not where the moisture was coming in. It was somewhere else on the side and quite far away. So yeah, I mentioned removing and cleaning of contents. There's not much evidence on cleaning like porous materials and things like that. The guidelines all say porous materials you toss, but sometimes you want to keep those porous materials. And I've been asked about that many times, like, you know, there's something, an antique piece of furnishing or something, or I've dealt with like archival materials and things like that too. So usually like paper you just toss, but sometimes they're archival materials. I've had to do like inspections in like a museum, for instance, and they really wanted to keep their materials. So we had to find ways of getting around that, drying those materials, and then if there was mold growing on them, to like do things like freeze drying and whatnot. But the evidence isn't very clear. There's really not much information out there on what works and what doesn't. For porous materials with settled dust and spores, you can HEPA vacuum or wash them. For semi-porous, like wood, you can scrape, scrub, or HEPA vacuum. And for non-porous materials, you can just clean them. One example of an interesting case was I was working in a bank, and they were concerned about the money. And so I went into the vault, and I was all under high security in this vault, looking at the money and testing the money. And I was so tempted to say, yeah, this money has to go. Yeah, just stick it in my knapsack, and I'll get it off your hands. But I didn't do that. I'll remediate, yes. So what about encapsulation? Well, when complete removal is not possible, sometimes people will encapsulate, meaning they'll just paint over it with like a type of encapsulant. That's often, that comes from like the asbestos industry, where they've used that quite a bit. There's little evidence to support this approach. People are concerned about what happens if there's leftover microbial contamination and if that sealant comes off over time. Is there still an issue? So it's best to try to remove it. I have used it and have seen it used in some circumstances, and you know, it seems to work when it's as sort of a last resort. What about biocides? Well, what do the guidelines say about biocides? Usually they say you just need to clean with soap and water. You don't need to actually use biocides to actually kill the fungi. You just get rid of it. And but some guidelines still indicate a dilute bleach and water solution can do the trick, a 10-to-1 sort of dilution. And there's some evidence that says that this will reduce the fungal viability and reduction of certain allergens, but then there's other studies that say it's not really very effective. So there's a bit of inconsistency in the literature. And also all the guidelines indicate, well, you got to be careful about the toxicity of biocides. Are you replacing one problem for another? But sometimes biocides are required for like contaminated water. And I've been in cases where I've been in like sewage contaminated crawl spaces, and in those cases, biocides may be necessary. And I would recommend it. I know a lot of you are budding industrial hygienists. If you can ever avoid being in a sewage contaminated crawl space, I would try to do that, because it's not the most pleasant experience. So what's the evidence for biocides? When they're applied to surfaces after remediation, they have been shown to reduce current growth or inhibit growth in some studies. Other studies find them quite ineffective. And for instance, there's one study that indicates that, yes, the biocides can stop growth. They're fungistatic, but they weren't fungicidal over time. So for flooding, usually the remediation strategies are the same. You just are dealing with more water intrusion, of course, than usual, and you have to deal with it more quickly. If there is sewage contamination, you may have different requirements, like biocides, for instance, I was talking about, and then also doing like a pre and post looking at enteric bacteria as well. And I've had to do that with those sewage contaminated soils and things like that, look at the soil and see if there's any enteric bacteria that we're seeing. So hidden mold, this has been an issue for many folks, where hidden mold, one definition is fungi and materials that or contents within the building enclosure, but concealed from view during a normal walk-through inspection. So we come across this, I've come across this a few times in my career, and I found that air sampling has been helpful in many cases. There was an example where I was working in the projects in Oakland. And so the landlord, or some might say slumlord, was trying to cover up the mold damage, and so had painted the whole complex, the inside of the complex, before we arrived. And so everything looked fairly pristine, other than I could see that underneath the windows it looked sort of almost like concave because they've been painted over so many times. But even with my moisture meter and all that, I couldn't see any elevated moisture readings, because in California it's dry, sometimes, and you'd have dry periods, so we weren't seeing any actual moisture. So from the visual inspection, I couldn't see anything. But from the air sampling, I was able to determine that, yeah, that indoors was quite degraded with respect to the outdoor air. I've also used boroscopes too. Boroscopes are very useful because what you do is, it's just this scope that you stick into a wall, and you can stick them in through an actual, you can make the hole that you can stick it through, or you could just use outlets and things like that to stick it through and move it around. And some of them have video camera capabilities and whatnot. There are disadvantages to those, because sometimes it's difficult to get oriented and know what you're looking at. And sometimes you get way too close to something in a wall and you can't tell, like, what am I looking at? Is it water intrusion? Is it mold? Is it just a piece of fluff? So I found destructive testing the most useful, but people don't normally like to do that. First off, break open a wall and look inside. But that's the best way of doing it. Infrared cameras are now coming into favor, which are useful. And they can, for instance, this example of the roof skylights, you can see moisture that you wouldn't see just by looking at it. For final steps for disposal, you want to be using 6 mil polyethylene bags, just thick plastic bags. There's no special disposal requirements for mold. For final cleaning and rebuilding, you want to make sure that the dust and debris is removed, and you have to vacuum or wet wipe the surfaces. You want to also clean the outside of containment areas too. That's usually recommended. The IRCRC recommends moving from cleaner to less clean areas and from top to bottom. And then after the moisture source has been eliminated, then rebuild. I wanted to say that 3 times so that hopefully we get that message through. And then the contents can be reintroduced. So for follow-up and prevention, just making sure that things are continually maintained and visually monitored. Trying to deal with the humidity and condensation issue if that has been an issue. Things like increasing ventilation, increasing indoor air temperature, insulating cold surfaces like HVAC ducts or cold pipes, and then maintaining the ventilation such that you're not hitting that dew point where you're getting condensation. So oftentimes you'll see, like you probably have visited some southern climates where it's so cold inside that you see condensation on the windows of these big conference halls and things like that. And so that's where the balance isn't there. So doing things like that can assist. There's some evidence that shows that equipping forced air systems with high efficiency filters can reduce fungal spores. But again, that's sort of a band-aid method. It's if there's a source, you deal with the source. But then if you want to reduce, the air concentrations, this has been shown to work. So for clearance, we want to determine if the remediation is actually effective. So you want to ensure that that space has been returned to sort of that pre-damage state. And this involves usually a visual inspection. That's your most important thing. And olfactory evaluation, just smelling, that's useful too. Moisture measurements, a white-black glove test just to see if there's dust still remaining on surfaces. And then sampling too. And there's controversy about sampling and whether people should be doing sampling. Some guidelines recommend it, some say you don't need it. A lot of times I find clients want it or people want it because they want to see that that the air concentrations have been reduced and they're below or similar to outdoor levels. So for the evidence on remediation, on how effective it is, we did look at that literature. And by effective, what do we mean by that? Do we mean effective in actually reducing visible contamination or the amount of airborne spores? Do we mean effective in reducing symptoms or health outcomes? Both. So we looked at both in the literature review. And what we found was, when you take out the mold damaged materials, you actually reduce the amount of mold. So that's very common sense. So several studies show that, that you definitely reduce the visible mold that's present and the spore counts as well. But we also see in some cases where that happens immediately, but then over time, if you follow it over time, those mold concentrations come up again. And it's because they haven't dealt with that moisture source, right? So some studies indicate that's happening. It does also improve health outcomes. So we've seen like a reduction in emergency room visits and hospitalizations of asthmatic children. Other housing improvements in one study showed that something like home insulation led to like a 50% reduction in visible mold and health improvements over 12 months. And we found studies that indicate that elimination of moisture intrusion really does reduce those asthma triggers. But what was found also is that some of the symptoms are alleviated more quickly than others. Headache and fatigue seem to be alleviated more quickly, whereas something like respiratory symptoms take longer. So why is that remediation and health evidence inconsistent? Well, I mentioned this before. It might be because not the microbial damage or the source has not actually been adequately addressed. It also could be that the health effects may not have been due to mold. It might have been due to other things that are associated with perhaps damp buildings. And there's a number of different agents that are in damp buildings outside of mold that could potentially cause a health effect or be associated with a health effect. Also, there could be the issue of the methods not being sensitive enough to actually detect health improvement within follow-up periods that were used in these studies. There are some promising interventions that need more evaluation, such as general and local exhaust ventilation and air cleaning devices, repeated dry steam cleaning, and repeated vacuuming. Now, these again don't deal with the source, but they do seem to help in actually reducing some of those airborne concentrations and surface concentrations. There's limitations with looking at all of these remediation studies and the effectiveness because blinding is not possible. You can't pretend you've just remediated a building. People know. So it's difficult to do that. It's difficult to compare the studies because they're very specific. The remediation is very specific to that building, and can it be sort of generalized and compared to other studies? It's difficult. And a lot of times those studies didn't actually talk about how they did the remediation. They just said, oh, we remediated, and then there was a health improvement. But there's no specifics as to what they did. And there's really no standardized measure to judge the success of remediation, so that's missing. So there's a few gaps, and what we need really are to develop some tools to fill those gaps. We want to be able to develop tools for monitoring and assessing the success of remediation, develop standards to determine the effectiveness of mold remediation, determine if remediation actually improves indoor air quality, determine if containment is necessary and then how much containment is necessary, and then also provide evidence that remediation improves actual health quality. So that's all I have today, and I wanted to open up to any questions or any feedback.
I'm going to start with an online question here, Mona,
Okay, sure.
which was around the infrared detection. And is that indicating heat or mold growth, or what does that show?
Well, it'll show the moisture because it's a different temperature from the other building materials. So
okay, so those red areas were cooler?
Yes. Yep. Yes. Oh, sorry. Oh, you're going to pass it on. Okay.
Hi, Mona. Thank you for the presentation. Just wondering, do you ever sample for the mold species? Like, is that necessary, and in what situation? Because if you see mold, you know it needs to be remediated, right?
Yeah, sometimes I will. A lot of times, if it's a health concern, sometimes we'll sample for the species. Also, sometimes it's difficult to tell if you're looking just at genus level indoors and outdoors, whether there's a degradation if those genus levels are about the same. So if you have 100 aspergillus and 100 aspergillus outside, you might, or let's say you have less, 80 inside, you might think, oh, well then we're fine. But if you were actually to speciate those, you might see it's all Aspergillus versicolor inside, whereas it's Aspergillus niger outside. So something totally different. And then you might go, oh, there might be a source of Aspergillus versicolor inside. And so that's when I found it very useful to do speciation. And I mostly, if I'm going to sample, if I'm going to go to the trouble of air sampling, I will go down to the species level. So I'll do the cultural samples, not just the spore trap. And I know a lot of people only do the spore trap. It's cheaper, it's faster. For the most part, you can get what you need, but oftentimes I've seen it and you've missed something. And so for the trouble of having someone go out there and spend the day doing that investigation, I think it's worthwhile to do that species ID.
Can I ask 2 questions? Hi, Mona. Thank you.
Hi, Wally.
So, thank you. 2 questions. One, back in the late 90s, early 2000s, there was a lot of leaky condo issue in BC. In your experience, is that still an issue currently, or what's your experience?
I haven't seen anything, now that I'm back in consulting, I haven't seen anything arise from the leaky condo situation back then, but I was familiar with it. I wasn't here in BC. I wasn't practicing as a hygienist here, but I think if you were to ask someone like Karen, she would be able to tell you a little bit more about that situation. But essentially, I haven't seen it right now, where we're getting a lot of requests from. There are still leaky condos, but I just haven't seen as much of the media coverage, etc. Yeah.
So my second question is, do you usually see more indoor mold issues in wetter climates than dry climates, or are the wetter climates actually better prepared to deal with it than the dry climates?
Yeah, no, it depends, because you'd think in certain areas, like I did a lot of work in Las Vegas, very dry climate, but they were doing they had some construction issues. They would, for instance, sometimes they wouldn't put flashing around the windows and things like that. So yeah, I think sometimes you're seeing them in dry climates because they're not as well prepared, or they're not addressing some of those construction-related issues early on. And the wetter climates, we see them in both. You'll see them in both, but San Francisco in certain areas are quite wet in the winter time, and we were seeing all over the U.S. we were seeing issues. So.
Okay. I'm just curious about libraries. Do they take precautionary measures to avoid their books getting moldy? Because that would be really unpleasant. guessing if your whole library, like
yes.
humidity levels and things like
that.
that.
Yeah. No, they usually do. And then, like with the museum I was working in, they had a lot of archival paper materials, and they had kept their temperatures and their humidity in a certain range, and they always had monitoring of that. So yeah, they did a pretty good job of that. That was, in that case, it was a sprinkler head that went off and just got everything wet. Yeah. So.
Hi, thanks. Okay. So I think that it would be really interesting to hear your comments. You were saying that you've served as an expert witness. And given the fact that the laws, tort laws, are completely different between Canada and the States. But what was your experience of being the expert witness and having the decision, the judge trying to sort out stuff without having any scientific background to understand the evidence?
Yeah, so there's a lot of background work before you actually go and do a trial testimony. So there's a lot of, there are reports and summaries and poster boards and things like that you put together to try to explain it to a lay audience or to the jury, right? So I would only be talking about the industrial hygiene aspects of things, the exposure assessment aspects of the testimony. We'd have occupational physicians talking about any health aspects of it, and also the engineers talking about structural components and building envelope issues. But yeah, it was always a struggle to try to convey the scientific information in a way that was really easily understandable and sort of like in bullet form, like really short and sweet, because we didn't want to explain difficult concepts and try to get mired down in all those details. But we had quite a bit of assistance. Like the firm that I was with did a lot of litigation work, and so we were all prepped on how to go about conveying information to a jury or to a judge. So.
Hi, Mona. That's great. Very interesting stuff. I'm curious about the industry, the growth of the industry, and workers. And it's been a while since I've looked at this literature. Are there good occupational health studies of the workers completing remediations?
No, no, there aren't. And we just looked at the literature, and we just weren't able to find anything. It was very, very. Karen was shaking her head too. So, yeah.
We actually tried to do a study on on this subject, and the industry is remarkably resistant to having any study done. But the workforce itself is, at least here in the Lower Mainland, was a highly mobile, call-on-demand kind of workforce, and we just couldn't get any good data out of it.
Well, I mean, anecdotally, like for me, I was not allergic to mold before I started in this industry, and then over the years, I've become quite allergic. And so I've sort of self-diagnosed. I don't know if that's a good thing, but I think I've diagnosed it to a particular penicillium species. And just because I see it, every time I would see it in high concentration, yeah, that was where I was suffering most. And it made it very difficult for me towards the end of the work I was doing in mold assessments, because I would always have to go in with full respirator. And, when I'm going into spaces with children running around and all that, and having to explain that to people was quite difficult. So I just said I was allergic to. I'm allergic to cats too. So I was like, I'm allergic to everything. So I just wear a respirator everywhere. So I didn't even. You know what? No, I didn't even think to pursue that at the time. I was pretty young, and fresh in this industry, and I went into these places without any. I must say. Bad, slap myself on the head. I didn't wear respiratory protection when I went into many of these homes.
Thanks so much, Mona. I was just wondering if you've ever worked in, say, like the agricultural or garbage disposal kind of industries, and if you have any comments regarding. Well,
I haven't had much experience in that regard, but I do know that those are areas of concern, and we've been contacted a few times on for compost workers and people concerned about like a Legionella. I think Karen was contacted too. So we were contacted about that as well with someone contracting Legionnaire's disease. And I've done quite a bit of work in Legionnaire's disease, but more from an indoor air quality perspective. So no, I don't have that much experience in that area.
Hi. Instead of using soapy water or diluted bleach water. Wouldn't it be better to use a baking soda? Just sprinkle or spray dry baking soda. Because in Japanese home remedy, it's known to, that baking soda is known to kill fungus. So maybe just simply sprinkling baking soda might kill molds.
Well, the thing is, the general sort of agreement is that you don't really need to kill the mold, you just remove it. And so really people are getting away from actually killing it. But I have seen some literature indicating baking soda has been useful for like household cleaning and things like that. Yeah, I have seen that literature. Actually, NCCH has something about household cleaning and vinegar and baking soda and things like that. So there is an evidence review on that as well.
You had some pretty interesting pictures in your presentation showing ceilings and walls that are all big black splotches.
Yeah.
I'm guessing that's all mold?
Yes.
Is it necessary to take drywall out to remediate places like that?
Yes.
Yeah, okay.
Yeah. Remove all of it.
Insulation in behind it?
Yes.
Wet,
anything that's wet or damaged like that, those are, the drywall is really porous or semi-porous, so you want to take it all out. Yeah. Yeah.
Okay, I think we have a couple of online questions to address here. Very impressive review, Mona. Some people are concerned about the potential linkage between mold exposure and pregnancy loss. Is there evidence for that?
I haven't seen anything related to that. No.
Are some drywall materials better than others? And please describe the problematic material to spell out. You thought it's EIFS?
EIFS.
EIFS.
Yeah. And it's this exterior insulation, I forgot the foam system, I think.
So are some drywall materials better than others?
Yeah, there are some materials that are advertised as being more resistant. They're more expensive. And then if there is a water intrusion problem and it's pretty extensive, you're going to have to remove it anyways, likely. So some people like to put this kind of drywall in like more humid environments like bathrooms and maybe kitchens. And yeah, there has been some evidence that that's better.
All right, if there's no further questions, we're just about at time. Thank you very much,
Okay,
Mona.
Great, thanks very much. Oh, and you can visit the NCCEH website if you want to access the evidence reviews. Okay, thank you.